This podcast is for informational purposes only and should not be considered legal, health, tax, professional advice. We're not responsible for any losses, damages, or liabilities that may arise from the use of this podcast. This podcast is not intended to replace professional medical advice. The views expressed in this podcast may not be those of the host or the management. This podcast may contain adult themes, so parental discretion is advised. Today, we welcome a fearless advocate who has spent nearly 30 years fighting for patients and families navigating a broken healthcare system. At just 18, Melissa Winger became a mother to a son with severe disabilities, exposing her to the harsh realities of medical care. Now a certified health care quality and patient experience professional, she's on a mission to push for real reform. In her powerful book, Who Cares? The Real Patient Experience, she uncovers the system's failure and demands changes. Join us as we dive into this critical conversation with Melissa. So, Melissa, how are you? If you care to expound on your credential or anything that I said during the introduction, you may do so now.
Thank you for having me. Yes, no, that was a perfect introduction. Thank you.
All right. No, at just 18, you were thrust into the system when you had your son. So what was the biggest challenge that you had to face during that time? What was the biggest challenge?
Yeah, so I did not, obviously, at 18 years old, know pretty much anything about the healthcare system that we have here in the US. And so I had my son at the age of 18, and I actually took him home as a typical baby. So, but come to find out, after trying to get him care in local ERs for the first 4 months of his life, where I was pretty much ignored, and I want to think now that that was because of my age, and literally just getting those typical stereotypes of, babies having babies, all of those things that teen
Yeah.
moms face. Yeah. That they never properly examined my child, and he was very sick. He was born 5 pounds, 15 ounces, but by the time he was 4 months old, he had lost over a pound. He was almost 4 pounds. And it was pretty horrible. The treatment we got, we were basically ignored. I do not know how we actually survived those 4 months, but he eventually was diagnosed with a chromosome disorder that has not, there's no name for it, super rare. He's missing half of his fourth chromosome. And that left him with problems with every single organ system. So he has problems with his heart, his intestines, he has bleeding disorders, he doesn't have an immune system, all of those things. And just shockingly, that he survived those 4 months without any medical care for his pretty serious conditions.
So that sort of had an influence on your perspective of the healthcare system then. That's how you came up with all of that.
And then ever
Okay.
since, trying to navigate the healthcare system. And so I wanted to write a book basically because it's a book I wanted to read and it didn't exist. I wanted to hear about another patient family going through the same thing. And it isn't from the perspective of a physician or a politician or an economist talking about health reform. I wanted to hear it from an actual patient. So the fact that it didn't exist left me to go, well, I guess I'll just have to write it.
Yes,
So that's what happened.
yes. Yes. Sometimes our greatest achievement can come from our lowest moment in life. Yes, it can. Because look at look at what you're able to bring out of
Yeah.
your, all the suffering and stuff that you had to go through. So that's beautiful. What do you think has changed in the healthcare system since you began advocating, or has it remained the same?
Yeah, that's what I was just going to say. Unfortunately, it takes a lot of strength to move a big mountain as our U.S. healthcare system, and but I'm still gonna do it. I'm still gonna say, and this is what I consider my purpose is. And I didn't figure this out till much later in life, only the last few years, that I was given my son for a reason. And him and I need to share our stories and our experiences and also work to make it better. I always said there was things that happened to my child in terms of patient safety, anything like that, that I immediately thought, this is never going to happen to anyone else again.
Mm-hmm.
And what do I have to do to change it? And people always ask, well, why didn't you sue? Because some of his errors were major medical errors that happened to him. And I said, well, I can't sue them because we're coming here next week for another surgery, right? Like he needed such specialized care that
Yeah.
else to go. And so I was like,
Good
that's
idea.
not going to work. That's not going to work. Yeah. That's going to leave a bad impression for our next visit here. But I wanted to work with the hospital. Hey, let's make sure this never happens again. What can I do to help? Because I feel like if you just complain about things, but then don't jump in and try to help fix it, it's kind of a waste of breath, right?
Yes, yes.
Mm-hmm. Yeah.
I want to talk about the purpose because I have a brother. He lives in England, and he has his first child was born disabled, and same chromosome, missing chromosome. That's
Oh, okay.
yes, but you know what? Because of that child, he has gone into healthcare that
Yeah.
focuses on taking care of disabled children. He has formed so many different organizations for them, for them to go on trips, for them to, some of them are allergic to peanuts and stuff and things like that. So to put them in an environment that they don't have to worry about anything like that, And I said, when you said about purpose and the child coming into your life, I just draw the parallel, and that was so profound when you said it, because I know it was the family, I've seen it. I've
That
seen
just
the joy
warms
on
my
her
heart.
face.
Yeah.
Yes, 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 yes. He does. He does. He puts him
Mhm.
into a medical environment where he basically, make sure they get home. Well, he's in England, so it's a little different from here. They provide homes for them and
Mhm.
24-hour care system and things like that. And
Mhm.
he's part of that, as well as
Wow.
making sure they can get to travel and do
Mhm.
things like everybody else,
Yeah.
just the care that they need. Yeah, so that
Yeah.
he said that just just
That's so
resonate.
great.
Yes, yes, yes. So
I love that.
yes.
Mhm.
Can you share an example of a heartbreaking or shocking patient experience that highlights the need for reform? Have you uh,
Many.
well, you're supposed to have
Yes. Okay. So
sit
this
to the
is where
choir, right?
yeah, and this is something. I mean, just like what you said moments ago is we have these what I consider to be extreme versions of caregiving for parents that have children that need. My son is developmentally probably more of a toddler age, even though he's 29 years old now. And he has a lot of medical needs, and he is 24/7 care to this day. And so you're having parents that have to do that have to take care of a child. There's no putting them in daycare. That's not an option.
No, no.
No. And so you're taking, and maybe there's home care, but I write about this in my book too, is home care is been understaffed for decades. So really that's not a good option either, because maybe you will get insurance to approve X number of hours, but you're not getting those hours. So it's this 24/7 responsibility that caregivers have to do. And that's what is kind of problematic, right? Because we send people who are needing hospital level care, and you will see families across this entire country who are running these hospital type ICUs in their own living rooms for children and for people. It's like there's no more of that hospital setting, but you're on your own in the hot. And believe me, at 19, 20, Yeah, I didn't have a medical degree, obviously, barely graduated high school. And I'm having to do these procedures, manage very complex medication schedules, but you're just told that's what you have to do because you're his mom. And
Right.
that made me feel extremely guilty, I guess, that I have to do it. If I can't do it, I am a horrible mother. His survival depends 100% on me. And that is something that I don't know how people do it. I don't know how I did it. I just came across on the other side and go, what did I do these last 10 years? Because I was living in a crisis moment for 10 plus years. And then the other option is, this is what I think is the most problematic in our healthcare system, is my son is now in a group home. And so I have had to deal with this long-term care system we have that is the most, I can't, I don't even know if I have words for it. It's almost as if we're putting people in third world countries that suffer from, and this isn't just the patients that are suffering, it is the staff in these places as well. The staff get paid very minimal for the work that they have to do. They are overworked, they're burnt out. They sometimes have to take care of 20 to 30 patients just with one person. The abuse and neglect rates in these facilities are just through the roof. It's just been this way. If you ever, talk to anybody who talks about maybe putting someone in a nursing home, they just get this look on their face, this cringe, like, oh, no. But why is that our only option? And then but it's been the same. It's been the same for decades. And honestly, when I was younger and my son was younger, I kind of knew that might be his future, and naive, thinking, oh, well, it'll be fixed and it'll be much better by the time he reaches adulthood. Yeah, I was wrong. So that is my biggest thing that I would like to change, because there's, for some reason, we have devalued people that need long-term care in a way that's incredibly sad and should not happen in the US.
So he's in a group home
Mm-hmm.
24/7. He
Yeah,
doesn't
he
come
lives
home.
there.
Oh, he doesn't come home to you any at all, like on the weekends or
Mm-hmm.
nothing?
No, so I go and visit him all the
Oh,
time.
okay,
Yeah,
okay.
so he has autism and his routine is his life. And
I
so
know. I
yeah,
know
and
about
to
it.
come home is like he just waits in my
Disruption.
front door. He's like, why
Mm.
are we here? And let's go back home.
Yeah, yes,
So
it's
I
true.
go there all the time.
Right.
I just moved recently to be much closer to him. So he's literally less than a mile away from me.
Do you have any other children other than him, or oh,
No,
that's
no,
him?
no. He's my
Okay.
full
Yeah, okay. No,
time
why I ask you?
dedication.
Why I ask you? Because my brother has two other children, and it's to balance between those and my niece who is challenged. That's why I was trying to find from your perspective how you manage that. That's why I was asking that question.
Oh, yeah, no, he's
Okay.
been my
Yep.
full
Yep.
time
Yep.
kiddo.
Now, in your book, you discussed the need for reform. What
Hmm.
are the what are the top three changes you believe that would make the biggest impact? What are the top three
Um,
changes?
what I came across over and over in every single chapter of my book was that, and this is going to be controversial probably, but it is, people with disabilities or people who are low income rely on government programs, right? Government health programs. So my son relies on Medicaid, and the Medicaid reimbursement rates are so incredibly low for providers that they just don't even accept the Medicaid insurance. This is particularly true with dental. There in my state, there's maybe two dental offices that will take Medicaid as an adult, and Medicaid only really covers pulling teeth out. They'll do preventative care and they'll pull teeth out. So and this is just, that's one example. Um, but people are very, especially with, not not to talk politics because I'm very bad at it. But when we look at Medicaid reform, people are very protective of, we don't want to lose Medicaid.
Mm-hmm.
So of course we don't want to lose Medicaid, but it's almost that we've accepted sort of this terrible version of healthcare versus not having anything.
Nothing. Yes.
Right? And so we don't even try for better. We don't even try to get the reimbursement rates higher, to get better care. But it has the way that Medicaid works, it affects all, even those that aren't on it, because the provider is paid so much less than other private insurance, that they have to charge more to private insurance to make up for the money they're losing with Medicaid. So, I mean, that's a big one, but it came across over and over and over. And I don't really have multiple, because I think this Medicaid and reimbursement falls in every single part of it's home care, it's pharmaceuticals, it's everything, right? And we also need to and then like I was saying before, the medical community and providers that are working in these long-term cares or home care, the payment rate, and I believe that goes back to Medicaid, they're not paid enough. They're not paid enough. That they need to get, 2 jobs, 3 jobs. The people that love this type of work aren't able to do it because they can't pay their bills, which I think is extremely unfortunate.
So what advice would you give like caregivers and families that feel that they, they feel unheard or dismissed by medical professionals? What advice would you give them if they're feeling that they're not being heard in regard to the care of the family member and, how things they think, what advice would you give?
I think it goes down to reaching into the heart of that provider. And it is not like an adversarial relationship where you think, if you argue with them, that they're going to respond more. I've had times where I've been very, very angry, or when I've been dismissed. And I remember just getting very serious with providers and just saying a couple sentences, just like, I need help. And please, I want you to care about us. I want you to care about what happens to us when we walk out this door. And sort of kind of reaching into that provider's heart, and also having an understanding what they're going through by seeing patients every 15 minutes, by having to care for 20 minutes, 20 other patients on a hospital floor. I think it's having that relationship, because that's where you're going to get connections versus having an adversarial relationship where you're just angry. It's having that kind of coming into a joint. Like, hey, I know that you are a very busy person, but I am struggling here, and I am literally just asking someone to care. And that's how I came up with the name of my book.
Oh, yes. That was interesting. Interesting
It really just takes this, like, we are all both human and we have hearts, and we just to fight, because I will tell you, as a mom and as an extreme caregiver, and us going to 60 medical appointments a year, I was tired of being angry. I couldn't stay at that level all the time.
Right. Definitely.
Which a lot of people do. They get so upset and so angry, and you stay at that level.
Speaking to you, I can see the emotional toll, how you speak, but the psychological toll, because a lot of people don't see that part. So, for being a lifelong patient advocate and fighting for others, how do you manage the psychological part of it? How do you manage?
I wish I had a good answer for that. What I learned, and if I could go back in time a long time ago, I wish I would have just told myself to enjoy my son, enjoy him. I was so focused on taking care of his medical needs 24/7 that there are hardly any pictures of us together.
Really?
No, So I
Um,
never took him any because I thought I don't want pictures of him with tubes coming out of his
I
nose and bandages
yes,
that
it's true.
I just didn't. And it wasn't easy. So this was talking 96, right? We know we didn't have them right on our phone.
Yes, it's true. Yes.
Yeah. But I wish I would have enjoyed, I wish I would have just taken him to the zoo, taken him, but I have to keep him alive. I have to keep him in this bubble. And I didn't get a chance to enjoy him. And if I
Mm.
could go back in time, I wanted to enjoy him more. And that's sort of the advice I would give to people is um, don't get caught up in it, even though it is your everyday, but enjoy your
Yes.
loved one that needs that he has medical needs. And my son, I just have to say, is probably the happiest person ever for somebody who has all of these medical issues. He gets up every day, wears a costume. He changes his costume 3, 4 times a day. He's either a clown or he's a ringmaster of a circus. He loves life. He loves every second of every day.
Yes. Sometimes the simple things for them is so profound. The simple
Yeah,
things. Yes, that's what I notice also.
it is
So,
very simple. Mhm.
yeah. Burnout. How do you manage when you get burnout? What do you do? Do you?
Um, that one's hard for me because, and this is what I think a lot of caregivers go through, is that you have this overwhelming sense of responsibility that you feel like this is your job. I am his mother and this is my job. I don't get to say I need a break. I don't get to ask for help. My sole job on this earth is to be his mother. And so I had to learn that that's not always true, right? That I can ask for help. I don't have to feel guilty about asking for help. I felt tremendous guilt putting him in a group home, knowing that that could cause, neglect or abuse or anything, maltreatment. And I still had to do it. And I got a lot of pushback for that, for why did you put your son in there? Um, I had to ignore all that. And I
Mm,
also want to say that where I found comfort is in a lot of social media, like Facebook page type things about, with other mothers and with other parents of children with special needs. But I also learned you have to take a break from that because what I started to do is take on their issues and feel
yes,
bad about like, let me help you with what
yes.
you're going through. Cause that was my nature is I'm going to help you. If I can, I'm going to. Well, now I'm not only taking care of my child. So I had to take off. I had to like take a break and be like, I
Right.
can't wrap myself into that. So
Yeah, yeah. But you say helping people. So what has been some of your rewarding moments, advocating for others?
mhm.
Do you have any that you could share with us? Rewarding moments
Yeah,
for,
what was absolutely great was that I was my first advocacy role was I got accepted to the Patient and Family Advisory Council at my local hospital. And I got that role when I was 19 years old. And that literally just shocked me because I thought, who wants to listen to a 19-year-old, right? So that was sort of the catalyst of my advocacy work. But the most beneficial, I think, was at this hospital, in the hospital that my son spent the majority of his childhood. I was able to go to every new employee orientation and tell them my son's story and to tell them how this mattered and this mattered for every employee that was going to start working there. We're talking all the way from housekeeping to surgeons. And I can say this is what's important to us and this is how you listen to us and this is how you work with us. And that was extremely rewarding to do.
well, I like the fact that you spoke to everybody, from the person who is
Mm-hmm.
taking out the patient in the wheelchair to the cafeteria people, any person, because we
Anybody.
are all caregivers.
Mm-hmm.
Anybody working in a hospital environment,
Yeah.
we are all caregivers. Doesn't matter what you
Mm-hmm.
do, we are all caregivers. All of
Yep.
us responsible for the patient.
My son's favorite person was the person that came in and mopped the floors of his hospital room. He would just sit up in his crib and we'd clap, and that was his favorite thing ever.
Okay.
So they are just as important, right, as anyone else in that hospital.
Yes, we definitely need them. Yes, 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 yes.
Yeah.
But so what would you say to parents or caregivers who are just
Mhm.
beginning their advocacy journey? Do you have any nuggets? Nuggets?
Yeah, I really think it's about giving yourself a break, and that it's
Mhm,
okay.
mhm.
I struggled with that for decades where I thought I didn't deserve a break, like just because I brought my son into this world, this is my responsibility. And I think it's telling people that it's okay to take a break. And one thing I learned, and this isn't medical advice at all, but I learned to, when things were brought up in a medical situation where there was a test that might be talked about, I always asked, what are we going to do with the results? Especially if it was an invasive test that would cause my child
Yes,
pain. What are we
yes,
going to do with the results? And if it's, oh, just to know, we're not going to change the course of
right,
action, then you
right.
might want to rethink that, right? Yeah. What's
Yeah,
needed?
yeah.
What is absolutely needed? Because quality of life is so huge.
Yes, that's so true. That's so
Yeah.
true.
Mhm.
Uh, and this sort of segues into the other question I have for you. Now, how can individuals
Mhm.
without medical background have, just like how you started off with nada, nothing, zero,
Yes.
effectively advocate for
Mhm.
for their loved ones? How
This
can
one
they?
was big, and I started to take notes.
Hmm.
I really, and now I believe, recording devices, anything like that, that you can take, because when you walk out of those appointments, I want to say you probably forget half the things that were talked about,
That's true. That's true.
right? Also, if you got sort of a shocking diagnosis, maybe that you weren't expecting, your mind just kind of goes blank. Like,
Blanks. Hmm.
right. And you don't
It's
hear
true.
anything after that. You don't hear
No.
anything that they just said after. Like,
No.
nothing. Um, bring help with you, especially if you have a child, because they don't care what's going on at the appointment. They just want to play or color or watch their iPads, and you're so busy dealing with your child that you're not listening. So if there
Right.
was any way to bring like a third person with you so that they can sort of entertain your child and you can focus on the appointment.
So suppose you had some superpower and you were able to 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 redesign the healthcare system, what would you do? What would you do? What would you what from
I
the
have
ground
to
up?
I
What would it look like? Just at a very high level.
Yep, I have to go back to my changing how we finance. It's
Yeah,
not, and
yeah.
it's unlike any other country. They can take care of
You're
people
in
for way
Canada,
less.
right?
No, Minnesota, very close.
Minnesota. Okay, well, I thought, yeah.
Basically
Okay.
Canada. But it's how we have the worst outcomes for the highest amount of money we pay for healthcare. That can't be right. So we need to really look at how we're spending the dollars.
Mm, okay. So, how do we ensure that patient stories and life experience drive policy changes rather than just being emotional appeals?
That's something also I had to learn. I had to actually take lessons, like research. How does like the government work, and how is me advocating like in the government space? I needed to really learn how that worked. I didn't learn much about that in high school. Maybe I did. Now I don't remember it, but I had to learn about who is going to be most effective to change any policy. How do I get my story across in sort of an elevator speech, right? They only have 2 or 3 or 4 minutes. What I've learned is when you're advocating like at that level, that you have to maybe put together a one pager of your story. and hand that off to them because they won't remember after talking with people all day. And they'll have this one story, and it's with a call for action. This is what we should do to
Action.
change it.
Okay.
And
Yes.
have a printout, have this that you can just give to them because they also, not only do I just have a bad memory, but sometimes they do as well. But the personal story is powerful. There is nothing more powerful than a personal story.
Yeah. So this is our last question. What message do you hope? What message do you hope readers take away from Who Cares? The Real Patient Experience. What message do you want them to take away from the book?
I hope that they step up and advocate, because I truly feel that this population, these sort of lifelong patients, people that have complex needs, people with disabilities, or people that are now in, like with dementia, Alzheimer's, they're the group that honestly gets taken advantage of. This is not the group that you're seeing out protesting in parades. These are a silent group and no one is speaking out. And that's what I would like to see. I'd like to see people give those people voices, speak up for them, make changes for them.
Okay, so here we have it, folks. Melissa, thank you for sharing your powerful story, your hard-earned wisdom, your unwavering dedication to patient advocacy. Your work not only exposed the weakness in the healthcare system, but also paves a way for real meaningful change. So to our listeners, if today's conversation resonates with you, I encourage you to purchase a copy of Melissa's book, Who Cares? The Real Patient Experience, and dive deeper into this healthcare topics and thoughts that Melissa has exposed. So Melissa, would you mind telling our listeners how to get in touch with you and about the book, where to get the book and all of that good stuff?
Yes. So I have a website. It is Who Cares Books, books with an S, whocaresbooks.com. From there, you'll see where you can purchase it. You can purchase it from Barnes & Noble or on Amazon. However, if you do purchase on Amazon, you have to type in Melissa Winger as the author. So there's an unpublished version of the same book. So make sure you type in Melissa Winger.
Yes, I saw that.
Yeah, it is. I used a pen name for the first month I had it, and then there was a lot of issues with using a pen name. So I'd unpublish and republish. So yes. And unfortunately, Amazon does not take off the old listing. They just unpublish. So Melissa Winger, it's yes. But if you go to Barnes & Noble, it's also available there too.
All right. So thank you so much. Thank you so much. And it was definitely a pleasure to, for us to have this very serious and powerful talk about, that affects all of us, not just disabled, but all of us as we age. We're going to have our issues to deal with too. So it's from the cradle to the grave.
Yes, that is it. That is exactly what it is. Yes.
Yes. So I thank you so much.
Thank you.